Today we are talking about something that affects almost every family in one way or another: heart disease and stroke. Even though medical science has made impressive progress, cardiovascular disease is still the #1 cause of death in the United States. The good news is that new data shows deaths are finally starting to decline again after years of pandemic-related setbacks. That means real lives are being saved, but it also means there is still a lot of work to do. Before we dive in, make sure you take a second to like this video and subscribe to our channel so you never miss important science-backed health updates. Your support helps us reach more people with life-saving information. Also, be sure to check the description box below for sources and references used in this video, so you can explore the research for yourself. Hello, I'm Pamela. I analyze the latest research on blood pressure, diabetes, and cardiovascular disease, translating complex scientific findings into clear, practical insights through educational video content. My goal is simple: to help you understand what the science really says and how you can apply it in your everyday life to protect your heart and your long-term health. Let's start with the big picture. According to the American Heart Association, someone in the United States dies from cardiovascular disease about every 34 seconds. That number is staggering when you really think about it. It means that while you are watching this video, several families somewhere in the country are losing a loved one to heart disease or stroke. And yet, there is also encouraging news. In 2023, there were roughly 25,000 fewer deaths from cardiovascular disease and stroke compared to 2022. That decline follows a difficult period during and after the COVID-19 pandemic, when heart-related deaths rose sharply. Many experts believe that the pandemic disrupted routine medical care, increased stress, reduced physical activity, and worsened chronic conditions like high blood pressure and diabetes. Now, as health systems stabilize and people return to more regular care, we are finally seeing improvements again. However, it is important not to become complacent. Even with the decline, cardiovascular disease still accounted for more than 15,000 deaths in 2023. That is more than cancer and accidents combined. In other words, heart disease and stroke remain the most serious public health threats in the country. The question is not just whether deaths are going down, but how we can keep this positive momentum going and accelerate it even further. One of the most powerful tools we have is prevention. Cardiologists and public health experts often estimate that up to 80% of heart disease is preventable. That is an extraordinary number. It means that most heart attacks, strokes, and heart failure cases do not have to happen if the right steps are taken early enough. Prevention is not about perfection. It is about consistent, manageable changes that reduce risk over time. Let's talk about the biggest drivers of heart disease. High blood pressure, also known as hypertension, is one of the most important risk factors. Nearly half of adults in the United States have high blood pressure. What makes hypertension especially dangerous is that it often has no obvious symptoms. You can feel completely fine while your blood vessels and heart are under constant strain. Over time, this strain damages arteries, increases the risk of heart attacks and strokes, and contributes to kidney disease and dementia. The encouraging part is that high blood pressure is one of the most treatable and modifiable risk factors. Modern medications are effective, affordable, and widely available. Lifestyle changes such as reducing salt intake, increasing physical activity, improving sleep, managing stress, and maintaining a healthy weight can dramatically improve blood pressure levels. Even small improvements can add years to life and significantly reduce the risk of serious cardiovascular events. Another major driver of heart disease is high cholesterol. Cholesterol itself is not the enemy. Your body needs it for important functions. The problem arises when low-density lipoprotein cholesterol, often called LDL or bad cholesterol, becomes too high. Excess LDL can build up in artery walls, forming plaques that narrow blood vessels and increase the risk of blockages. These blockages can lead to heart attacks and strokes. Like high blood pressure, high cholesterol can often be managed with a combination of diet, exercise, and medication when needed. Diabetes is another critical risk factor. High blood sugar damages blood vessels and nerves, making the heart and brain more vulnerable. People with diabetes are significantly more likely to develop cardiovascular disease. The rise in type 2 diabetes is closely linked to obesity, physical inactivity, and poor dietary patterns. Managing blood sugar through medication, healthy eating, regular movement, and weight management can substantially lower cardiovascular risk. Smoking remains one of the most dangerous habits for heart health. Tobacco use damages blood vessels, increases inflammation, raises blood pressure, and reduces oxygen delivery throughout the body. Quitting smoking is one of the fastest ways to reduce cardiovascular risk. Within months of quitting, circulation improves and blood pressure begins to normalize. Within a few years, the risk of heart disease drops dramatically. Now let's talk about a surprising and concerning trend that researchers have noticed. While overall stroke deaths have declined, stroke rates have increased in certain age groups, including young adults aged 25 to 34 and adults over 85. Traditionally, stroke has been more common in people over 65, so seeing rising rates in younger adults is alarming. Experts believe this may be linked to increasing rates of high blood pressure, diabetes, obesity, physical inactivity, and tobacco use among younger populations. This trend sends a very clear message. Heart disease and stroke are not just problems of old age. The foundation for cardiovascular health is built early in life. The habits you develop in your 20s, 30s, and 40s matter enormously. Waiting until symptoms appear is often too late. Prevention must start long before the disease becomes visible. One of the most useful frameworks for prevention comes from the American Heart Association's Life's Essentials 8. This set of guidelines focuses on 4 health behaviors and 4 health factors. The 4 behaviors are eating better, being more active, quitting tobacco, and getting enough quality sleep. The 4 health factors are managing weight, cholesterol, blood sugar, and blood pressure. Together, these 8 areas cover the core elements of cardiovascular health. Let's break these down in a practical way. Eating better does not mean following extreme diets or eliminating entire food groups unless medically necessary. It means focusing on whole, minimally processed foods. Fruits, vegetables, whole grains, lean proteins, legumes, nuts, and healthy fats provide nutrients that support heart health. Reducing excess sodium, added sugars, and highly processed foods can significantly improve blood pressure and cholesterol levels. Physical activity is another cornerstone. You do not need to become a marathon runner to protect your heart. Even moderate activity, such as brisk walking for 30 minutes most days of the week, can improve cardiovascular fitness, lower blood pressure, reduce stress, and help regulate blood sugar. Strength training a few times per week adds additional benefits by improving muscle mass and metabolic health. Sleep is often overlooked, but it plays a powerful role in heart health. Chronic sleep deprivation is linked to higher blood pressure, increased inflammation, weight gain, and impaired blood sugar control. Many people treat sleep as optional, but the science is very clear. Getting consistent, high-quality sleep is essential for long-term cardiovascular protection. Aim for 7 to 9 hours per night and prioritize good sleep hygiene, such as limiting screen time before bed and maintaining a consistent sleep schedule. Managing weight is not about achieving a specific number on the scale. It is about maintaining a body composition that supports metabolic health. Even modest weight loss in people who are overweight can significantly improve blood pressure, cholesterol, and blood sugar levels. Sustainable changes matter far more than rapid, extreme weight loss. Blood sugar management is especially important for people with prediabetes or diabetes. Regular monitoring, medication adherence, dietary changes, and physical activity all play a role. Keeping blood sugar within target ranges reduces damage to blood vessels and lowers the risk of heart disease and stroke. Blood pressure management, as we discussed earlier, is critical. Regular monitoring at home or during medical visits helps identify problems early. If medication is prescribed, taking it consistently as directed is essential. Combining medication with lifestyle changes produces the strongest results. Cholesterol management may involve dietary changes, physical activity, and sometimes statins or other medications. The goal is to reduce plaque buildup in arteries and maintain healthy blood flow. Now, let's talk about something that often gets ignored in health conversations: the environment around us. Individual choices matter, but community-level factors also play a major role in cardiovascular health. Access to safe walking paths, parks, and green spaces makes it easier for people to stay active. Availability of affordable, healthy food options influences dietary habits. Public policies that reduce sodium in processed foods, support smoking cessation programs, and expand access to preventive health care can have a massive impact on population health. You may not be able to change national policy on your own, but you can advocate for healthier environments in your community. Supporting local initiatives that promote walkable neighborhoods, school nutrition programs, and community fitness spaces contributes to long-term change. One of the most important pieces of advice from cardiologists is to start small. Big lifestyle changes can feel overwhelming. When people try to change everything at once, they often burn out and give up. Instead, focus on bite-sized, achievable goals. For example, instead of saying, "I'm going to exercise more," say, "I will take the stairs twice a day." Instead of saying, "I will eat perfectly," say, "I will add 1 extra serving of vegetables to my dinner." These small actions build momentum and create lasting habits. Celebrating small wins is not trivial. It reinforces positive behavior and keeps motivation high. Over time, these small changes compound into meaningful improvements in health. Think of it like compound interest for your body. Each healthy choice adds a little more protection to your cardiovascular system. Another important factor is regular health checkups. Many risk factors for heart disease, such as high blood pressure and high cholesterol, do not cause symptoms until significant damage has already occurred. Routine screenings allow problems to be detected early when they are easiest to manage. If you have a family history of heart disease, diabetes, or stroke, regular monitoring becomes even more important. Stress management is another piece of the puzzle. Chronic stress contributes to high blood pressure, inflammation, unhealthy coping behaviors, and poor sleep. Techniques such as mindfulness, deep breathing, physical activity, social connection, and setting healthy boundaries can help reduce stress levels. You do not need to eliminate stress entirely, which is unrealistic, but learning how to manage it effectively can protect your heart. Let's also talk about younger viewers for a moment. If you are in your 20s or 30s, it is easy to assume that heart disease is something you will worry about later. But the data shows that risk factors are increasing in younger populations. High blood pressure, obesity, and diabetes are appearing earlier in life. The habits you build now will shape your health trajectory for decades. Investing in your cardiovascular health early pays enormous dividends later. For older adults, it is never too late to make positive changes. Even in later life, improving diet, increasing physical activity, quitting smoking, and managing blood pressure and cholesterol can reduce the risk of heart attacks and strokes. The body has an incredible ability to respond to healthier behaviors at any age. Another point worth emphasizing is medication adherence. When doctors prescribe medications for blood pressure, cholesterol, or diabetes, they do so because the benefits outweigh the risks for that individual. Skipping doses or stopping medication without medical guidance can reverse progress and increase risk. If you experience side effects or have concerns, talk to your healthcare provider. There are often alternative options that can be tried. Now, let's bring this all together. The recent decline in cardiovascular deaths is encouraging, but it should not make us complacent. Heart disease and stroke still take more lives than any other causes. The science is clear. Most cardiovascular disease is preventable. We have effective medications, strong lifestyle interventions, and growing public awareness. What we need is consistent action at both the individual and community levels. Think about one change you can start today. Maybe it is checking your blood pressure for the first time. Maybe it is replacing sugary drinks with water. Maybe it is going for a 20-minute walk this evening. Maybe it is scheduling a long overdue checkup. These small steps matter more than you might realize. As we wrap up, I want to remind you that knowledge is only powerful when it is applied. Watching this video is a great first step, but the real impact comes from what you do next. Share this information with friends and family. Encourage the people you care about to take their heart health seriously. Support one another in building healthier habits. If you found this video helpful, remember to like it and subscribe to the channel so you can stay updated on the latest research and practical health advice. And once again, don't forget to check the description box for sources and references if you want to dive deeper into the studies discussed today. Thank you for spending this time with me. Your health is one of your most valuable assets. Protecting your heart is not just about adding years to your life, but about adding life to your years. Stay informed, stay proactive, and I'll see you in the next video.